Also, one of the things that's interesting is once you get into Medicaid, it's not this simple one-stop shopping typically in most states where just, okay, you Google Medicaid and you're going to get all of your answers. It seems like states have multiple programs for different types of services. And sometimes there's programs for nursing homes and then waivers for home health care, or even programs for covering some services for people in assisted living. Just wondering, how does that work in Pennsylvania, and what are the different programs? Like, how does that break out?
Right. So, first of all, you're right that Medicaid is a lifesaver for an awful lot of families because they get sick. They're told they can't leave the hospital. They're going to need long-term care. And then they find out that Medicare only pays for a very short period of time in a skilled facility. So they scramble to figure out how are they not going to blow their entire life savings on the long-term care, because nobody is disciplined about their savings and spending for their whole life only to have it go completely down the tubes in the last few years of their life because of healthcare. So Medicaid planning is very important. In Pennsylvania, Medicaid is technically called medical assistance. Every state implements the federal Medicaid program, and they often have different names for it. So medical assistance in Pennsylvania applies to the highest level of care. So skilled nursing care, where you're in a facility, you're getting either nursing care, you're getting occupational therapy, physical therapy, other types of skilled care. The middle level of care would be something like assisted living, or in Pennsylvania, more commonly, it's called a personal care residence. That's a distinction that people don't really need to understand. It's more a regulatory language issue, and practically there's not much of a difference. But for the most part, Medicaid or medical assistance in Pennsylvania does not pay for that level of care. The lowest level is care that would be provided in the home by a home care agency or a skilled home health agency that would send nurses to the home. That, again, Medicaid is not going to pay for it, but that's where there's some room for what is often called in elder law circles a waiver program. What is being waived is the normal requirement that Medicaid is paying for care in a skilled facility. So the idea is, and I'll just highlight one alternative that's a waiver program in Pennsylvania that people might want to check out, and it's called the LIFE program. LIFE stands for Living Independence for the Elderly, and it's so you stay in your home, which is really what everybody wants. I've yet to meet a person who says, I really want to move to a nursing facility. They want to stay at home. And what the LIFE program does is, even if you're medically eligible for whatever reason with your condition to go into a skilled nursing facility, if it's safe for you to stay in your home, so, maybe not for somebody who has dementia and is prone to wandering or something like that, but if you can stay there and have health care brought to you, the LIFE program will either provide that care that you need in the home, or more commonly, they will transport you to a local center, and they're throughout the state. And at that center, it's a one-stop shop for every type of healthcare service that you could need. And again, this is the same as if you had Medicaid in a skilled nursing facility. It's all paid for. And you go and you get your doctor visit, you get your eyes checked, your dental needs, any sort of physical therapy. Plus there's socialization with other people and, the kind of stimulation that avoids the health detriment of isolation. So the LIFE program is great for people who are safe to stay in their home and want to stay in their home and still have that medical eligibility for Medicaid. So that's a Medicaid-like situation in Pennsylvania, but we're not like states like Florida that have multiple levels of Medicaid, that even apply in assisted living. Unfortunately, the $10,000 to $15,000 range for skilled nursing facility, that can be avoided with Medicaid planning with an elder law attorney. The assisted living, you're a little more hard pressed to find government benefits. Maybe if you have veterans benefits or something of that nature, but you're looking at probably $4,500 a month there.
It's interesting because that home health care route really seems to be the direction everything is moving in right now, and it seems to be for a combination of reasons. First of all, like you said, very few people actually want to go into any type of senior living. Most people would rather stay in their home if they can, but it's just a question of whether it's safe. And then at some point, a person needs so much care that not only is it unsafe, but if it's 24/7 home health care, it's actually going to be even more expensive typically than a nursing home. So it becomes totally impractical. But for a typical person, it only requires a few hours a day of additional supplemental care, and then maybe has a family member that helps out. Those can be great options. And I think the states are finding that it's also economically a lot better for the states to pay for that than to end up with a person going into a nursing home, perhaps at 2 or 3 times the cost. You also have COVID, I think, which is, concerns about that and not wanting to be in a nursing home are also pushing things in that direction. But I don't think that that's something that's going to change in the near future. I think we'll see more and more of those programs popping up around the country.
You're absolutely right. It's good for the people who need the care. It's good for the governments paying for the care. It's good for everybody. And there's long been talk in Pennsylvania in the state legislature about expanding funding and support for community-based care as opposed to facility-based care for just those reasons. But yeah, COVID certainly put a damper on that conversation. But I still tend to think like you do, that will be more encouraged in the future. I mean, just with the graying of America, the baby boom generation growing, fewer people to provide the care, I think we're going to need to do more in the community than we do in facilities.